facet joint disease of the lumbar spine. So the facet joints in the lumbar spine are these joints in the back where the motion occurs in the back. Here's the spine like this on me, front, back. These are the discs in the front. For every disc in the front, you have 2 facet joints in the back. That's where the motion occurs in the back. So the vertebra is what's numbered. The vertebra are L1, L2, L3, L4, L5. L means lumbar. Then S1, S2 for sacrum. The disc and the facet joints are in between the bones. That's where the bones move, in between the joints. So the facet joints have 2 numbers. The bottom facet joints are L5, S1 because they're in between those 2 bones. And up top, L1, L2, etc., etc. So the facet joints aren't very big. You can see the size compared to the disc. They're only about 20% the size of the disc. Well, guess what? Pain and biologic activity is only about 20% through the facet joints versus the disc. So most people's back pain is from the disc. That's the workhorse. But the facet joints can get arthritic and overgrown and hypertrophy and be a source of pain. A CT SPECT scan is a great test that can light up metabolic stress and activity. If a facet joint lights up hot on the bone scan, it may be the source of the pain. But these facet joints aren't that big. They're not typically a real debilitating source of pain in only about 10% of people that we see. But it may be in combination with degenerative disc pain and facet pain. They can go together. Facet joint arthritis is degeneration, wear and tear, osteoarthritis, aging. It's what happens to all of us. It starts around age 28 and it's pretty much downhill from there. So we're all in the same boat. So what do you do about it non-operatively is get your core strong, get your muscles strong to keep the stress off the joints. Use our Back Doctor app that has the whole program in there. How do you know if it's facet joint pain? Typically, when you lean back, when you extend your back or rotate and bend to that side, if it causes pain in your back, can go into your butt and into your SI joint right in that area, it may be facet joint pain. An injection, a cortisone shot with lidocaine and numbing medicine into the joint, typically under x-ray guidance, if it relieves your pain, it's further concordance that your pain may be coming from that joint. As far as treatment goes, a injection, like we mentioned, can temporarily help. The rhizotomy radiofrequency ablation is a procedure that goes in and burns the little nerve that goes to the joint, can get rid of the pain fibers from the joint so you don't sense the pain. It doesn't treat the degeneration, it doesn't treat the arthritis or the pathology of the joint, but it gets rid of the pain sensors so you don't feel the pain. So who cares if it's still there if you don't feel the pain? But those nerves can grow back after 9 or 12 months and the pain can come back. But that's a pretty safe procedure that a lot of times may be worth trying. As far as from a surgical perspective, the surgery for a painful facet joint is to fuse it. If you stop the motion across any painful joint, it stops the pain. But a fusion can put more stress on other levels. If you're interested in that, you can check our next video on fusion of the lumbar spine is how to treat facet joint pain. One other component is if a facet joint gets overgrown with arthritis, you know how when your knuckle moves, your finger moves, the knuckle gets bigger and arthritic? Well, the facet joints can get arthritic and overgrown with cysts, synovial cysts, joint capsule cysts of joint fluid, and bone spurs can pinch down on the nerves and cause stenosis or sciatica and nerve pain. So a lot of times the overgrowth of the facet joint causes nerve pain. And if that's the case, sometimes we do a microscopic surgery to shave down the overgrowth of the joint to treat the nerve pain. But it does not treat the joint pain because the joint is still arthritic, it's still moving. So we'll do that surgery, it takes 45 minutes outpatient, but that treats nerve pain. That's only if you have nerve pain. How do you know if it's nerve pain? If it goes down your leg, especially below the knee. If it goes below the knee, typically from standing, because when you stand, the stenosis gets worse. If it goes down below the knee, the nerve goes below the knee, the L5 and the S1 nerves do, then it may be nerve pain, and doing the microscopic surgery may help. But if it stays in your back and into your butt, and it's when you lean back to that side, and if we diagnose that we think it's more facet joint pain, the microscopic surgery to remove the bone spur doesn't treat that because the joint is still there, it's still painful, still arthritic. So the next steps are you have 2 options. One is you can email us at info@watkinsspine.com with your information, or you can check the next video on a fusion of how to treat facet joint pain in the lumbar spine. Thank you.